Hi everyone, this is Andre here. Today we're talking about a patient who fell from a ladder, a 7-foot ladder. He was working on the house, probably doing something on the roof, and fell from the ladder, and he injured his lower back and his ankle. Went to the family doctor, and the doctor gave him a diagnosis that he injured his second lumbar, seven lumbar vertebrae. So the L2, he basically injured his L2, and the pain has been quite severe, and he had trouble sleeping at night, and because of the pain, he need to take a couple of painkillers to help him with the pain so he couldn't fall asleep. So when he came to me, he was saying that he told me the lower back, it was hurting a lot, and also his right ankle. So when I asked him to describe the pain, he told me that the pain is actually coming from here and then radiating like a belt all the way to the front and to his groin. So that's based on Western medicine diagnosis. He did injure his L2, and when L2 is injured, the nerves are kind of goes around in this area, and exactly like what he said. But however, based on Chinese medicine, we have something more than a structural system. There's something called meridian that exists in our body. A meridian is like a highway connecting our body from head to toe, and there are many there are about 14 meridians, major meridians. So imagine meridian kind of like a highway connecting one town to the other town, but and whatever happens on one end of the meridian will affect on the other end. So for example, if you have traffic jam on somewhere on the highway, the whole highway can be affected. The traffic can be slower, they can be, people are angry because of the traffic and things like that. And what we could do, it was based on Chinese medicine theory, is that if we help clear out, activate the meridian and improve the flow in the meridian, it will help resolve any of the accumulation. For example, like I said, if there's a traffic jam on some part of the highway, what you can do is to help speed up the traffic all along the highway. So let's say if section 1 here is having traffic jam, but section 3 doesn't have traffic jam, but it's what you can do is kind of speed up section 3, section 2, and help clear out this traffic stuck in section 1. So that's kind of basically how it works. And needling on the meridian itself will also work, and there are some meridians on our body that has what we call a command point, or a point basically that's activating the whole meridian. So one single point can activate the whole meridian. So that's very useful when you're treating a large area of injury, or a large area of or a condition that affecting a large area. For example, if you want to treat the whole lower back pain, or for example this man's pain, you probably will have to needle kind of everywhere along wherever he was hurting, even all the way to the front to his groin, and that can be a little bit embarrassing for him and for me as well. So there are other ways to do about it, and there are many things like that in Chinese medicine, especially in acupuncture. Imagine I think everybody's familiar how how the ceiling light doesn't. There's another switch on the wall there's a switch on the wall that's control the ceiling light. So by just flicking the switch on and off, you can control the light. So when the light is broken, you're not just gonna check the light bulb if it needs replacement, or the circuit or the fixture is broken. You also need to check the line connecting from the light to the switch, and as well as the switch itself, right? So if you have experience of dry needling or IMS from physiotherapists, they are based on the Western medicine theory. So they based their acupuncture is, or their dry needling IMS is based on the musculoskeletal structure. So meaning that they see, okay, this muscle is broken and we need to fix this muscle in order for your body to work, function properly. So when your ceiling light is broken, they're gonna take down the light bulb, they're gonna check the light fixture and everything just on the ceiling light itself. And so, but they don't know that actually there's a light switch that can control the light, and also there's a circuit connecting from the switch to the light. So sometimes this works, their IMS dry needling works wonderfully, but sometimes it doesn't work because they are not, there's a missing part in what they can see in their theory. So what they understand is different, is not the whole picture compared to what we understand. So we see the body as a whole, as holistic. So one part of our body can affect maybe your shoulder or your back. It doesn't necessarily have to be a local problem causing local pain. It can be started from somewhere else. So when I'm treating patients, it's interesting. Some patient will ask, "Oh, can you put needles where I'm hurting? Like, would that help?" Generally, it helps, but in my opinion, it doesn't help as much as the meridian. It's more, when patient asks that, I would still put the needles in there, more as a placebo effect rather than therapeutic effect. So for example, if a patient comes in for pain in the lower back, I put needles on his arms and hands, and sometimes he would wonder, why don't you put needles in my lower back? And even though the patient was getting better from the treatment, he would still wonder if he could get even better from directly needling on the lower back itself. So sometimes, based on patient's requests, I do switch the method of my treatment, and sometimes they find that they are equally effective. Sometimes they find it not as effective, just because sometimes it's not always the case that the lower back problem, there's something locally causing the lower back issue. And when we're targeting a large area, it's much easier to use this command point, or this like a light switch type of point, to activate the whole area or activate the whole channel, rather than putting needles all over the area. For example, 2 needles can activate 1 meridian or 2 meridians. And if you want to put needles along the meridian, you might be looking at 10, 12, 20 needles. So for people who are who doesn't like the feeling of acupuncture, I would normally do it with the traditional way. So this person, let's go back to our point. Excuse me. So this person has pain coming from his lower back, radiating to the side, to the front, like a belt. In Chinese medicine, there is a meridian called belt meridian. Dun, dun, dun. How convenient. And the belt meridian basically goes around from our lower back to the front, kind of like a belt, hence the name. And the belt meridian has two activating points on the foot, and it's somewhere around here. It's not focusing. Anyways, so anyway, it's on the gallbladder meridian of the number 41st point on the gallbladder meridian. So gallbladder 41 activates the belt meridian. So by kneeling, gallbladder point, these 2 points on one on each side will activate the belt meridian and will be able to help this person's pain. There are also other meridians involved with his pain. So he injured his L2 from, did I say that? Anyway, he went to his family doctor, and family doctor said, oh, your L2 is injured, your second lumbar spine is injured, that's why it's causing the pain. So our spine is also on our governing meridian, which coming from basically covers the spine on your back. So there's a point that activates our governing meridian, which is on the back of your, on the pinky side of your fist, around here. So now we have points to activate this area horizontally and also vertically, and these 2 points are generally enough to treat this problem, this pain, manage this pain. But however, he injured his spine. Spine is part of the bone, right? So there's another common point that activate the bones. Basically, you think a switch to turn on all the cells, all the bone cells in our body, to make them more activate, to metabolism faster, to recover faster, so new cells will grow faster to replace the dying cell. And the points are bladder 11, which is on the upper back. Anyways, you probably not be interested in learning all these, but just for the sake of it, it's around here, bladder 11. And there's a point, there are points to activate the bone marrows in our whole body. So, which is on gallbladder 39. It's on the outer calf. So on this medial malleolus, about 4 finger breadths above the lateral malleolus, which is the most prominent bone of your ankle. So 4 finger breadth up around here. And the last point, which is bladder 40, basically they are command points on the back of your knees to improve the blood circulation in the lower, basically in your back, especially the lower back. So these 5 points will kind of be a good prescription for treating this person's lumbar injury. So I saw him about 4 times every week in the past 4 weeks. After the 3rd treatment, he said that the pain, it's much subsided, and there's about 30% left. And in the beginning, he had to take painkillers to fall asleep, to not waking up at night. But now he doesn't need to take that painkillers anymore. So overall, it's very smooth case, very effective. I'm expecting that he will be okay after 5th or the 6th treatment. So the most important point I want to tell everyone is that you don't necessarily have to needle where it hurts. You can do that, but there are other ways around it as well, and it's much easier, less needles used, especially for people who are more sensitive to pain or to needles. This can be a good method. If you're liking the dry needling or IMS, sure, go for it. It would help you to. It will help most of the people, but sometimes if it doesn't help, then you might want to look at seeing an actual acupuncturist or a TCM doctor to kind of further expand the vision a bit, to kind of see what exactly is causing your problem. It's not only just, it might not be a cause that's happening locally. It can be a systematic issue causing the local pain. Anyways, that's it for today. I'll see you next time. Bye.